Hello and welcome to Dan Austin's computer-based training system. The following information will take you through your annual refresher training on the topics of bloodborne pathogens and access to medical records. First, we'll take a look at bloodborne pathogens, what they are, how you can be exposed, and what you can do to protect yourself. According to the OSHA standard, bloodborne pathogens are defined as diseases that are transmitted through bodily fluids, such as blood or other potential infectious materials, OPIM. Since you work in an industry where there is reasonable potential that you may be exposed to blood or other bodily fluids in response to an accident, it is important that you understand how to protect yourself from possible exposure. The most common forms of bloodborne pathogens are the hepatitis B virus, the hepatitis C virus, and the human immunodeficiency virus, or HIV. Hepatitis C has been known to live outside of the body for up to 1 week and up to 2 weeks in a laboratory setting. When dealing with an injured person or cleaning up an area where an incident has happened, there is the potential that there may be blood or bodily fluids that you may come into contact with. It is important that you follow some basic universal precautions. Always assume that the area contains potentially infectious materials, so guard against these infectious materials. Use the appropriate level of PPE or barrier protection, such as latex or nitrile gloves, glasses, goggles or face shields, masks, and protective disposable outer garment. Use a mixture of 1 part bleach, 10 parts water to disinfect any potential infected equipment or work areas. Avoid accidental injury from sharps or protruding objects. And avoid biohazards. And always wash your hands and skin after removing your protective equipment or if you have been exposed to any bodily fluids. If you are exposed to any potential infectious materials, report that exposure immediately to your supervisor and wash any exposed areas with soap and water. It's important to know what your role is in an emergency or when rendering first aid to an injured coworker. Review the information in your site-specific emergency plan. The plan will help you identify who are the trained first responders, a list of trained personnel, a list of notification responsibilities, where first aid stations are located, and any site-specific procedures that may need to be followed. The 4 basic steps you need to follow in an emergency response are to notify your supervisor or the appropriate personnel as soon as possible. Assess the situation before proceeding to offer help. You must be able to ensure your own safety before you can help someone in an emergency. Don't become another victim. Stabilize the injured person in accordance with your level of training or assist those who are trained to do so. And once the injured person has been stabilized, transport them to the nearest facility or medical provider. If you are confronted with a situation that requires your response or your help with administering first aid, remember, always protect yourself with the appropriate barrier of protection to any possible exposure to blood or bodily fluids. Remember to report the emergency immediately to your supervisor and report any possible exposure that you may have suffered. And respond only to your level of training. You as an employee have certain privacy rights guaranteed when it comes to the availability or access to your medical, testing, and exposure records. All test results must be kept in your medical and exposure files and are protected by privacy and access rights, are not open to viewing without your written consent except by yourself or recognized company officials. Also, your employer is to maintain a copy of these medical testing and exposure records for 30 years past the last date of employment. So let's review. Bloodborne pathogens are diseases that are transmitted through bodily fluids such as blood and saliva. The most common forms of bloodborne pathogens are the hepatitis B virus, the hepatitis C virus, and the human immunodeficiency virus, or HIV. Universal precautions should be followed. Use the appropriate level of PPE or barrier protection such as latex or nitrile gloves, glasses, goggles or face shields, masks, and protective disposable outer garments. Use a mixture of 1 part bleach to 10 parts water to disinfect any potentially infected equipment or work areas. Always wash your hands and skin after removing your protective equipment or if you have been exposed to any bodily fluids. Report any exposures to potentially infectious materials immediately to your supervisor and wash any exposed areas with the soap and water. Know where your first aid stations are located and know any site-specific procedures that you may need to follow.